So better asthma control basically means we don't want you to have any symptoms in the day, in the night. We don't want you to end up in hospital because of an exacerbation. We don't want you to ever need to use oral steroids where you're very unwell. And yeah, that's basically the main reason why we try to encourage good asthma care and management. So asthma gets worse. So asthma is an inflammatory response in your airways or in your lungs. And when you're unwell, you get a buildup of inflammation in your lungs, and that is what can cause you to have a wheeze. That is what can cause you to have a cough and to feel very unwell, whether you're exercising or at any point in your lifetime. And if you've got asthma, it is one of the main causes of exacerbations when you have buildup of inflammation. So your inhalers have changed because recently the national guidelines were updated, where the British Thoracic Society, Asthma Lung UK, NICE, who are the governing body for guidelines, and the Scottish Intercollegiate Society as well, felt that it is better for us to give patients a combined inhaler that puts both your inhaled steroid and a reliever, which is the blue one that, as you know it, together to enhance the treatment that you get for asthma, because everybody responds to asthma differently. But this has been found to be the best way and to improve asthma care in the UK, because we are one of the worst for asthma deaths. And one of the main reasons is we want to stop that from happening and to improve the lifestyle that you have and to improve your lung function and to improve your general well being. So I mentioned maintenance in terms of how you use your inhaler, and that is where you need your inhaler on a daily basis. And you can refer to the maintenance and reliever therapy video for more information. So this depends on how what you use your inhaler for. So some people have symptoms of asthma when they're exercising and only need it for exercising, and some patients also need it on a regular basis because they've got a cold or because they're of pollen or because they're constantly exercising. So it really depends on how and what you're doing that makes your asthma symptoms worse. So as part of trying to be responsible in the NHS, using dry powder inhalers has been found to have less carbon footprint. So it doesn't mean that we're giving you a cheaper inhalers, but it's actually we're trying to improve your asthma care as well as look after the environment. It's understandable to be hesitant about any new change, and it will get you. It takes time for you to get used to breaking the cycle of being used to using, say, for example, your blue inhaler all the time. But it will take time, so I would encourage everyone to give it some time to get used to it, because once you're used to it, you will find it more beneficial in the end. You might be feeling worried again about not being used to carrying your blue inhaler, but in actual fact, if you think about it, what is the point of carrying something that could end up doing more harm than good? So again, it will take time. We completely understand that it's something that it's a cycle that we need to break. But we will just encourage you to keep persisting with the new change, and eventually it will get better. If you're having to use your blue or your reliever inhaler 3 or more times a week, we need to be seeing you. We don't want you to wait till you're very unwell before we get to see you. We need to see you when things change. So if you're on a daily inhaler and you're normally doing one low dose a day, but then you start to notice that you're using it frequently, you're using it 2 or more times a week, 2 or 3 times a week, 4 times a week, then we need to be seeing you. So please do not wait till it gets to a point where you need to be in hospital. We need to see you as soon as anything changes. So if we're close, so your GP surgery is always the best. So Fresh Forest Medical during the day, in the evenings or at the weekends, NHS 111, and it would either be a doctor or any of the nurses who are well trained in asthma care as well. So in summary, inhalers have changed, or I would say let's call it the treatment of asthma and management of asthma has changed because the national guidelines have been updated and improved. Because we want to improve and reduce the risk of you having an exacerbation. Because we also want to make it more flexible for you that instead of having two separate inhalers where you're trying to figure out which one am I meant to be using, you now have one inhaler which does both, or whichever way you use it. Like I said, you're either using it as a reliever or you're using the same inhaler as a maintenance as well. And ultimately, it's to make sure that you're much better, you're more improved. Your asthma symptoms are not causing you to have a less quality lifestyle, but actually to make things much better in the long run.